question. Do you mind telling us why you got into this industry?
Sure. Yeah. So I started medical school when I was very young. I got in when I was 19. So I wanted to be a doctor, I think my whole life. I had some medical conditions when I was younger, which actually led to having a kidney removed when I was 11.
Wow.
And that's the old time. And now they do it through telescope surgery. This is where they cut you in half, literally. Like I have a scar that goes halfway around my body. And so I used to tell people I had had a shark bite.
That's so crazy.
And so I got very interested in medicine because I was in the hospital. And then, so I got into medicine and I got into women's health, mostly because I was pissed off. I do a lot of things out of anger.
So do I. It sounds very familiar.
And I'm like, oh, there's a wall. I'm going to run through it. I'm going to make a door. And I remember sitting in medical school being kind of angry that all of my lectures were from men, even lectures about women's reproductive health. And this was in the 1980s. And so this was, a different time, definitely. And
Yeah.
I just felt that, women deserved the best and I was the best. So I was going to go into healthcare. And I was also very motivated when I was in medical school. The abortion law in Canada was struck down, and I was very active. When I was in high school, I used to ride my 10-speed bike to go and support the freestanding abortion clinic and stand outside, and because it was a big deal at the time. And in 1989, the abortion law was struck down in Canada, which was just huge because there's no law; it's just a medical procedure, and so that was just really impactful for me. So I just said, well, I'm going to go into OBGYN. And I think a lot of people go into it because they're, all about like birthing babies. And that was all great.
Right.
But for me, it was really more about the whole comprehensive care experience for women.
That's so awesome. Yeah, really relate to the doing things because you see the problem or it's I think you're so motivated by that right now, especially. But yeah, I mean, I'm so thankful for women like you. A little bit about my story. So I also have a plethora of health issues. I didn't become a doctor. However, I do have PCOS. And so I went to 17 gynecologists. Nobody listened to me. It was a really, really rough journey. I was very lucky to actually find one endocrinologist who finally listened to me. I think probably only the third doctor that was female that I had seen.
Mhm.
And she was the one that diagnosed me with PCOS. But it also took me so long after that to figure out that my seizures, because I've had seizures since I was 15, that they are actually connected to my PCOS. And, it's a frustrating journey, but I always, with my story and the way that I say it, it's very much also about advocating for yourself because there are incredible doctors out there. And it's not about hating the field. It's more about I think fighting for education because I think we don't have, I mean, and please chime in, we don't have a lot of studies on women's health compared. And so I think it's just about being able to talk to your doctor and describe to the best of your ability what you're feeling. How have you seen just the evolution, I guess, of PCOS and how it's diagnosed now?
Yeah. So it's been huge changes. Like, certainly when I was in medical school, I, I mean, it was barely mentioned, but we knew very little about it. And, there are kind of reasons we knew very little about it. Well, one, we have a lot better technology today. So the assays that we use to look at hormones and things like that, I mean, they're way better than they were in the 80s, right? So think about
Yeah.
like, cell phones didn't exist, fax machines didn't, like, so technology's
Right.
changed a lot. So that's part of it. But we also didn't have people that were interested. Right. So there's that. And I think as more women get into medicine, that started to push the envelope that we should be interested in these things. And, the problem is sort of the overreaching patriarchy, and I hate to use that as like the blame, but it's easier to blame women for their health conditions than to investigate those health conditions, right? And so women with PCOS were just told, well, it's because you're overweight, and that's it, and that was like the end of discussion. And now we know that being overweight has nothing to do with getting PCOS, right? That it
Right.
is a completely independent thing. It can make the condition worse, just like it can make other conditions worse, but it's not a cause and effect. And I think something that is sort of talked about a lot is that, it wasn't until 1993, I think, or 92, that women were required to be in clinical trials in the United States. And it's important to know that a lot of that is left over from thalidomide, which, was a drug that was available in other countries that caused terrible birth defects. But it was also an easy excuse, right? That, you find ways, it is more expensive to study things in women who have, hormones that change every day versus, men
Right.
that don't. And so it was kind of an easy way for everybody to be like, oh, okay, yeah, we don't need to do that. And it was a cop out. And I think that in the last, you know, 20 years or even 10 years, the amount of research and things that we're seeing take off, it just,
Yeah.
it's really so amazing. Like, when I was in medical school, we know anything about the genetics of polycystic ovarian syndrome. And we know that it's this incredibly what we call polygenic medical condition that maybe has been around for tens of thousands of years. And,
Right.
we're trying to understand that. And so it's hard because when it's you affected, you want the science to catch up. But
Right.
what I would say is the amount of research we're seeing seems to be, increasingly exponential, which is fantastic.
Yeah. That's awesome. And obviously awesome to hear. And I think, uh, you know, for me, that's why I also love to talk about it because I feel like the more that you talk about it, the more awareness there is. On the patient side, I think it's so much for me anyway. It was about okay, now I know what I have. Now what? And I really hope that is something that also gets better is how to move forward with it. Not everybody goes right on medication. Not sometimes it's a process trying to figure out what works best for your body, which I think in so many ways is in general a healthy thing because we should be listening to our body. No body is the same. Some things work for some people, others don't. And so um, I'm just such an advocate for making sure that you also stepped up to the plate and make sure that you are doing everything that you can to help your body because I don't think there is a very quick fix. After I had my son, I was able to actually regulate my hormones after that. And that is, as far as I know, extremely rare. I mean, obviously, my doctor was thrilled to hear that, but it was the first time I'd ever had a regular period. The first time that I've been able to kind of get my insulin resistance under control, and it almost like did a reset, which I know can be very opposite when after you have a baby with PCOS. And so, um, I'm very thankful for that. But yeah, I mean, it's such a process. But I so appreciate you just in general being on Substack and connecting with people and being available in that way because I think that there's a lot of mistrust in the medical field, and I think that's really unfair as well. But yeah,
One
go for
tip, yeah, one tip that I would give to people is, when you're struggling or it feels like you're struggling or you are struggling, to get the care you need, or to be heard is to write down the things that are bothering you. I use this term, the bother factor, right? So whether it's, for example, let's just take PCOS. Whether is it the acne? Is it the irregular cycles? Is it concerns about infertility? Is it all of it? What are the things that are bothering you? And to write them down in the order that they matter to you. Right. So like if I could leave the office just having one of these things fixed, which would it be? And then kind of go down the list. And it doesn't mean that you shouldn't have all of those things done. But, if I always say, if somebody comes to your house and you have 15 things to fix, it's probably unlikely that the handyman's going to be able to fix all of those at once. Right. So you're like, okay, what's the worst thing? My roof is leaking. I need that fixed first. What's the thing that bothers you second? And then you can kind of work down the list. And sometimes what happens is, if the top one or two gets corrected, then sometimes other things on the list get corrected too.
so true.
And so that's kind of a good sort of organized way to go in because sometimes you can go in and then all of a sudden everything you want to say just like disappears from your head. And
Yeah,
it gets very stressful. And that happens to doctors too when they go to appointments. So I
that's
just
good to know.
and I have a little bit, more insight because I have kids who've had a lot of really serious medical problems. So I know what it's like to
I'm
actually go
sorry.
and sit and sort of be like, okay, I've got my list. It's very helpful. And, I love when people come in with lists because then I know that they can go back afterwards and look at the list. right? And say, okay,
Yeah.
I had that question answered. I had that question answered. And so, that would be the thing that I would say is the most important thing. And then if your doctor's like blowing you off, say, well, how am I going to get this top problem addressed? What are we going to do today to address this top problem?
Yeah. Yeah, I think that's very, very valuable. What are you, in general, what do you like to focus on as a doctor? I mentioned PCOS. You talked a little bit about why you got into the industry, but what is your favorite thing to explore and study, I suppose?
Yeah, so I have several kind of areas of expertise. So after medical school and residency in Canada, OB/GYN is 5 years, so it's a little bit longer than down here. I did a fellowship in infectious diseases. So
Wow.
I'm what's kind of known as a tertiary care specialist. So I see people who have struggled to get the care that they need for a variety of different reasons. Sometimes it's because they weren't listened to, sometimes it's because their problems are really complex. And so I see kind of, I would say, three groups of people in my practice. I see people with very complex vaginal infections like recurrent yeast or recurrent BV or other types of things, or vaginal symptoms. A lot of them are women in menopause with vaginal symptoms that haven't been adequately treated with what's going on. I see people who have pain, so pain with sex, pelvic pain, and then I see a lot of menopause people. And because all of these things often overlap, so I
Yeah.
see a lot of people with um, polycystic ovarian syndrome or type 2 diabetes or metabolic syndrome, because one, those are super common, but two, they may be associated with some of these other things because of systemic inflammation. And so, so we're often tuning up these other aspects of care.
Yeah.
Because I have more time to talk to people in the office, that's something I negotiated when I took my job about
That's
20 years
very cool.
ago. That I'll see people who come in and maybe they're coming for recurrent yeast, but I also see like their PCOS is not being addressed, or they've. I'm like, hey, what do you mean you're only having 2 periods a year? We need to talk about that. Let's get the
Yeah.
investigation going. And oh, I see you had an ultrasound done a year ago, and it looks like you have polycystic ovaries on that ultrasound. So I'm picking up all kinds of aspects of that care as I'm managing people for those other conditions.
Yeah. What do you think you're most yeah, I was gonna say excited, but in general, what are you hoping to see the medical field, how it progresses in the next, 5 years, say? What are you hoping for? I know it's kind of a big question.
Yeah, I'm hoping for the government to get out of examination rooms. I suppose that would be like my number one thing,
Yeah.
because that's something that you never think about in residency or medical school, and so that just adds a whole layer. I mean, we just heard today that, that they're going to put a warning label on Tylenol, and it's just like, it's just all these ways to make everything harder. So
Yeah.
that would be one thing I would wish. I would actually wish for regulation of supplements and things like that, because there's a lot of misleading information, which makes it then very difficult to talk to people in the office. And also, if your supplement is really good, you should study it and prove it. And so I wish that there was better regulation there. I mean, I really believe that regulations help people. And I wish, that we had so much more funding for what we call basic science. So, one of the problems that we're so behind with women's healthcare is that we don't know what's going on at a cellular level. So, if we don't know like what receptor is a problem or where that inflammation is coming from, we can't design the best treatments. We're sort of making these guesses. And so we really, really need, instead of another supplement or this, we actually need money for labs that are studying the basic science of these conditions. And so that's what we actually need, because then we can then start to say, okay, we know this receptor is an issue and this is, so do we want to block this receptor, or do we want to promote this, this other, suppress this type of inflammation? And so I feel like for PCOS, endometriosis, I mean, when you talk about these two conditions and the percentage of women that they affect, right?
Yeah.
And we still don't really know at a basic science level what is going on. So if I had a magic wand, I would pick I would pick figuring out the basic science of PCOS and figuring out the basic science of endometriosis.
Really love that. And I really hope for that. I know, fingers, toes, everything crossed, I mean, and I think we'll get there. It's just about time. But I love the regulation on supplements. I think that is an incredibly important. Uh, I mean, just in general, I hope that happens because of so much misinformation too. And I think to your point about it, you know, prove that it works. I think it's also just in general what should go together and what shouldn't. Because I also still feel like there are things that are taken together that shouldn't be taken together, or too much of something. You know, just because it's really good for you doesn't mean that there shouldn't be a regulated amount that you're supposed to take.
Yeah.
And
You
I mean,
deserve
if
to
you
know. Sorry, go ahead.
oh no, I was going to say, even if you this is such a watered down simple thing, but if you ever have had too much B12, it's awful. Have you ever had too much B12 and like gotten so itchy and like you can't get rid of it for 2 weeks? I know that sounds so weird. I did it by accident. I didn't realize how many of the things that was taking had B12 in it. And so you overdose on B12 and you kind of just have to get it out of your system. It's a stupid example, but it's one of those things where B12 is great, within a lot of our supplements or our daily supplements. And it's still something that you should make sure that you're only taking the right amount. Otherwise, it sucks.
Absolutely. I mean, many of these medications or these supplements have interactions that we don't know about because they're
Yeah,
understudied. Many of them don't contain what they claim. Some of them are adulterated with hormones. So,
yeah,
and especially, I would say that for women with PCOS, because many of the supplements will say that they're good for metabolic health, or
right.
they'll say that, they can help with weight loss. And studies have told us that supplements that advertise weight loss or metabolic health have a higher rate of being adulterated with things like weight loss drugs. So it's just important that you know what you're taking. And when I prescribe fluconazole for yeast infection. My patient goes to the pharmacy and she knows that if it's a 150 milligram tablet, that tablet's going to contain between 148 milligrams and 152 milligrams of fluconazole and doesn't have anything else. And that's what it is. And she knows what the fillers are. But
Yeah,
if you go and take a supplement, you don't know. And I just think that government should be invested in looking after their people. And you should be able to, if you're picking something off the shelf, it should contain what it claims. I
yep,
feel very strongly about that because that's how people get into problems, and they have no idea that they're getting into problems. And so yeah, better regulation would be helpful. Maybe not
yeah.
so much for billionaires, but certainly for everybody else.
Yeah, yeah, exactly. Yeah, and I mean, again, to go back to just good doctors out there. I mean, even my neurologist, he prescribes me folic acid with my medication. It's not that they don't work; it's just using them correctly. And I think there's a really beautiful mixture of both Western and Eastern medicine. It doesn't necessarily have to be one or the other. It's just to your point, you need to know what you're taking, why you're taking it, and what's in it. And I mean, all of that comes down to education ultimately, not just clinical studies, but just in general education, being aware of how your body works, your basic anatomy, your basic system, and not a lot of people get that.
Yeah. So that's a huge problem. I would say that most people graduate high school knowing more about frog biology than human biology.
Yep.
And it's a problem. So if you go in and you don't know the questions to ask, then you're at a disadvantage. I mean, and
Yeah.
that's one of the big reasons why I became so passionate about delivering health communication information to people and raising awareness. You know the questions to ask. I mean, it's your body, and I believe in all forms of choice. If you want to choose this particular therapy, I'm okay with that as long as you've been informed in advance and know the questions to ask,
Yep.
right? Because if you're uninformed, it's not an educated decision. And so I have lots of patients that make decisions that I don't agree with or that I wouldn't do, but I feel very confident that they've been informed and they're making the choice that works for them. And that's okay. And I think that
Yeah.
medicine has been so patriarchal for so long. It's like, well, I'm prescribing this, you need to do it this way. And it's like, well, there's lots of different ways to do it. You're the person who has to live with taking the medication. You're the person who has to
Yeah.
live with the condition, and everybody gets to decide how that works for them, just as long as the information's correct. Because if somebody was lying to you about how much gas you need to put in your car to get from A to B, you hadn't then made an informed choice about taking that trip, right? So,
Yeah. Yeah, that makes total sense. Yeah. And I saw a study recently that I think it was over 70% of women don't actually know every part of their anatomy. So if you see, a blank maybe printout of your body, particularly, your ovaries, they can't point out what certain things are.
Yeah, I mean, we see that in my office. I have these big pictures on the wall
Yeah,
of neuroanatomy, but also of genital anatomy. So, with the clitorises, the labia minora, the labia majora, all of that. And the number of women who just, when I walk in, who are just standing looking at it is it's pretty
yeah,
high. And I would say that, we also suffer from a lot of the, when we talk about, for example, where the ovaries are, everybody used to kind of this image that looks like a T shape, but that's kind of a cartoon almost. And that's, not
right.
true. And yeah, I think that if people just had a greater understanding of their anatomy, a greater understanding of just some of the basic physiology about how things work, it
Yeah,
just, I mean, education helps everybody. I mean, maybe it doesn't help people who are trying to take advantage of you, but it helps everybody else. And
yeah,
it's again, that's why I do a lot of what I do because I want to bring everybody's level up so they can come in and be an informed patient. And people usually get a lot more interested in their health too when they're engaged in making active decisions.
yeah, yeah. And that sigh was just a sigh in agreement. Okay, I'm gonna move my location because the Wi-Fi is nice, but I look crazy and I'm like half in the shade. So bear with me for just a second. Oh
Well,
my goodness.
you look
I
great.
am not as organized as I usually try and be. So I appreciate your patience. Um, my son is almost 5 and he is the sweetest kid ever. And our friends are really sweet letting us stay with them. But it's I was chaotic this morning and my Wi-Fi wasn't working. So it was one of those mornings. But
Well, 5 is
um
a great age. I
it
love that age
is
'cause they say the funniest things and they can
they do.
play with you and, you're just I used that's, that was a favorite age. I have twins. My boys are 22 now.
That's crazy. It feels like that's gonna be here in a second. But twins, my husband was like, if we had twins, we're done. And we ended up only having one on purpose as well. And are yeah, one and done. But I cannot imagine birthing twins. How was
My
that?
Well, I had unfortunately a very complicated pregnancy because when you're an OBGYN, you get to have
You're
course.
aware of everything too, I'm sure.
Yeah, well, I actually had triplets and, went into labor I ruptured my membranes at 22 and a half weeks, and I delivered my
Oh my
son
goodness.
who died. And then
I'm
I managed
sorry.
to stay pregnant for 3.5 more weeks until 26 weeks when I got an infection, and then my boys they were very, very premature. They weighed, 1 pound, 13 ounces and 1 pound, 11 ounces, and they were
Oh,
in neonatal intensive care unit for a long time, and then son Oliver also unfortunately had a complex cardiac defect, and so he needed a heart surgery, and he's had a couple of surgeries. And so, that really has given me an incredible empathy for what it's like to be in the doctor's office and not have answers, and to have very complex medical conditions and be like, well, he's like, we don't have an answer for that. This is the best medicine can do. And I certainly, when my kids came home and they were still had all kinds of problems. This was the early days of the internet, and I found myself going down rabbit holes, and I made
yeah,
switches to formulas that I wish I hadn't done, and I did some things I wish I hadn't done, and it was all because medicine didn't have the answers, and other people kind of promised that they did.
yeah.
And so I have an incredible amount of empathy for people in that situation.
Yeah, yeah, and I mean, desperation at the end of the day, right? Looking for that answer, it's incredibly overwhelming, and then you add the fact that it's your kids, and I get it. Yeah,
Yeah.
I'm so sorry that it's just I as a mom, you never want anybody to go through something like that. It's your fear as well, but just in general, that ugh, my heart breaks. It's it's such
Well,
a vulnerable process too. Even if everything is completely 100% healthy, it's such a life altering experience. And then to have all of that is just hard. But they're doing good now.
yeah,
21
22
and
and they're
22. Yeah.
college and, one is
Wild.
criminology and the other one, I guess, is studying, writing and wants to, be an author and maybe an English professor. So
You're
they're
doing it right.
they're living their best life. I had the
Good.
funniest call with one of my sons the other day, and he's the one who wants to be a writer, and he's got his CV going because he's applying to MFA programs and all this stuff. And he's like doing research at the university and all this kind of stuff. And, it's his like dream to do his MFA at a couple of different programs. But he was going to do these backup things as well, just in case if he didn't get in. And I said, sweetheart, you're going to be 23. And no one ever says when they're 50, boy, I wish I hadn't taken my shot. So,
Yeah.
so just apply to the ones that are your top picks, that are your dream, and go for your dream. And if you don't get it, okay, well, then you'll work for a year and then you can reapply. Like, you're only going to be 23. Like, shoot your shot, go for it.
He's so young, so much time. Yeah. And that's, I completely agree. That's great advice too. Aw, I love being a boy mom. And I know I would obviously love whatever I would be saying the same thing if I only had a girl. You know what I mean? I love being a girl mom, but it's so cool to raise a little boy.
Yeah,
And
I feel
yeah,
the same way. I thought when I found out I was having all three boys, I was like, what the hell am I going to do? Like, I don't know. And then now I'm like,
yeah.
well, what would I have done with
What
girls?
would I have done with a girl? I know. I have so many friends that have little girls, and I'm like, you are brave and strong because I think that boys are so funny and wild and they're all over the place, and girls are amazing too, but they're little mental, like, I hate to use the word terrorists, but like they're little mental terrorists. They're so manipulative at little. They already know how to control the household, which I think is hilarious and great in its own way. Raising strong women.
Yeah, absolutely. Women that, it's very easy to be labeled difficult when you question things, right? That
Yep.
tool of the patriarchy is to tell you that you're questioning this, you're wrong, the status quo. You should have an acceptable answer to every question you ask. There should be an acceptable answer. And if there isn't, it could be because the answer doesn't exist. But asking that question is never wrong. And I think that has been sort of the pervasive way that society has been for so long, is that when women ask questions, they're difficult. And when men
Yeah.
ask questions, oh, you're so interesting. So
Hmm.
much to contribute, right? And so, I think that women need to keep asking questions and keep demanding, better care, and advocating for better care in ways that bring up all women, and
Yeah.
really promote science, because we want to be able to give people accurate information. I always tell people, if I sort of alluded to this earlier, if you don't know how much gas you're putting in your car, how can you get from A to B? So if you have incorrect information, we all want to go to the gas pump that's dispensing the gas correctly, that
Yeah.
has the same amount of, there's no surprises. And so that's sort of my scientific analogy, is that, science is a process. So what we know today could change in 5 years, 10 years. That's okay. That doesn't mean we were wrong. It means that we've advanced. In fact, when we learn new things that tell us what we knew 15 years ago was wrong, I get so excited because it means we've learned something else. And that means we can help people that much better.
I completely agree, and I think that is a sign that something is working. So, I've heard that counter argument where it's like they don't even know what they're talking about. It's like, no, no, no. When science has another answer, they update it. They don't pretend like the other method, was right. They fix it. They expand, and that's the whole point. Science, whether it's the medical field or going to space, it's like you that's the whole point, is the more you learn, the better you get, and not, the other way around. And so I'm happy to hear that. I completely agree. As far as women asking questions, I am right there with you. In so many fields, you feel that pushback, that know your place, or yeah, that accept the answer. As far as raising a kid in general, even just taking away the female aspect, I think I think so many people experience this, is the because I said so
Mhm.
answer.
Yeah.
And I do everything I can, and it's hard. I do everything I can to not say that to Hendrix. And I think there's an importance there when you say, I actually don't know, let's figure it out together. Not just because, moms and dads don't know everything, but also just the the question isn't wrong. They're just, to your point, there might not be an answer. Like, ask the question. I like the question. I'll give you my, best answer, and at times the most age appropriate answer. But just in general, I think that is so important because if we stop asking questions, things don't progress anymore. I love the kids. Yeah, I love the kids that have so many questions, and I feel like they grow up to be the people that find the answers, and that is super cool. That's exactly what we want for our next generation.
Absolutely. And I think that nobody is ever hurt with education either. And I think that's a really important thing as well. I think that we're going to see, more and more pushback against, education about biology in schools. And I think it's
Yeah.
really, really important. We're seeing banned books and other types of things. And I think it's really, really important for people to understand that education, when people want to suppress knowledge, that's to maintain the status quo or,
Yeah.
to have something else. Like knowledge shouldn't be if knowledge is frightening to the people in power, then the people in power are the ones that have the problem.
And you know what shows us that? History.
Yeah, exactly.
It's not a new concept.
Yeah.
Yeah, absolutely. And I think the sad thing here right now in the States is that a lot of kids don't get that at home. And that's also the point of school. It's more than just the basics. It's like there's there's a lot of kids that need school to teach them lots of different things, and it is their only outlet. And so taking things away is just so unfair and so sad. And at the end of the day, kids are so much smarter than we give them credit for, and they're so observant, and observing the wrong things changes their trajectory of their life in so many ways. I really hope that things start turning around. I mean, I know that I try with Hendrix everything that I can, but so many parents just don't have any resources.
Yeah, and you don't know. Like I couldn't teach my kids about, I don't know, it's many aspects of history because like I'm not an expert in that. You expect
Yeah,
that kids are going to learn at school, but there's also, I mean, for example, with what we call sex education, but it really should be more like reproductive health education because it's, calling it about sex is, I think, kind of dismissive of the whole importance of everything that's happening.
yeah,
There are kids that graduate that, like I said at the beginning, that know very, very little biology. And, nothing bad happens. I mean, my kids have been exposed to pictures of vulvas and vaginas and discussions. I mean, I wrote a book called The Vagina Bible. It's sitting out. And, my sons are always pointing it out at the window at bookstores when they're with friends, that
hey, my mom did that.
yeah, exactly. And,
Yeah,
there's nothing bad has happened because they've learned all of that. And I think that, I would say to people, like, what are you afraid of? Are you afraid of people having sexual agency? Are you afraid of people controlling when they get pregnant? Like, how are those things bad?
yeah,
They're not. But suppressing knowledge is beneficial, to the status quo. So, we really the more we can educate people, the better. I mean, it's amazing to me sometimes, I'll see women who are in their 50s or 60s standing up and they're like, "So can you go over the parts for me?" And I just feel so sad that I'm so happy that they feel comfortable asking. But
yeah,
I'm so sad and so angry at the same time at the world that has created that situation.
yeah. And if this is too personal, we can move on. But how did you have the talk, the birds and the bees talk with your sons?
You know, I think because there was so much discussion about everything
Yeah,
that it was like there wasn't like a talk. It was just kind of all like as we went along, they learned sort of what was kind of age appropriate kind of as we went along. And, when in my kids' school, they actually had a very enlightened reproductive health biology section in class, and they were, I think, in grade 7. And the teacher comes in, and they learned everything. They learned to label the parts of the clitoris, like everything. And so
yeah.
the teacher said, "Okay, we want to just find out like what's the comfort level in your house, talking about things." And one of my sons put his hands up and said, "Well, my mom wrote about her vagina for the New York Times."
That's amazing.
And so the teacher was like, "Okay, so we're going to say that you're comfortable."
That is so cute. I love that.
So I just think it wasn't like there was no sitting down in the talk. It was just kind of this like progressive increase in information. And the best advice somebody gave me, and I don't know where this came from, was when they ask you a question about sex, start talking using obviously like, biologically appropriate terms. And as soon as their eyes go blank and they tune out, just stop.
Mm,
And so, you just continue because, you can tell your kids are, like, totally not interested, and then you just
totally.
stop. And so I think it was just kind of like a progressive increase. I just asked their questions, we talked about it, there were pictures everywhere, "What's this?" "Oh, well, that, babies come out of there." I mean, we were at a at a shower when they were maybe they might have been 4, we were at a neighbor's baby shower, and somebody was saying, "Oh, the stork brings babies to these other kids." And one of my sons said, um, "Babies come out of vaginas, except we came out of our mommy's tummy, but they cut us out with a knife, not a fork." It was very, very, very
Very
insistent.
specific.
Knife, not a fork.
That is adorable, and I love every part of that. Yeah, and again, right? What harm does it do? Nothing. Nothing. They know, and I think that there's also so much power in, and I mean this in such a positive way, when men know, how a woman works. It's one of those things where, like, just even sympathy, right? If you have a female partner, understanding what she's going through at her time of the month, or supporting her when she's pregnant or sexually, whatever it is, it's like it's only a benefit. It only deepens connections. It only, helps intimacy and all of those things. And that age appropriate progression, I think, is a wonderful thing. And also, yeah, kids say so many funny things. The fork, that kills me.
I Knife, not a fork. It's like, but yeah, I mean, that's why, it's funny, I was on the news in Canada a while back talking about my book Blood, which is, like, all about the reproductive health and, basically from puberty to menopause. It covers everything. Big chapter on PCOS as well. And, this report, yeah, the anchor was interviewing me, and after she said, "I have to tell you something. I was reading this book to prepare for this interview, and my wife said that that was the hottest thing that I've ever done, was, like, read this book about women's health." And he's like, "Dude, you're sleeping on this." I mean, he didn't say that in the
That's
interview, but
amazing.
it's don't you wanna know about your partner? Don't you wanna know what they're going through? Don't you wanna know what's going on in the world? Like, I'm just
Yeah.
curious about biology. Like, when I learn about, I don't know, wherever, how, like, four-toed newts, reproduce or whatever, I'm like, "Ooh, that's fascinating." But knowing what's happening to your partner, especially if they're suffering, I mean, even if there's nothing that you can physically do in the moment, the fact that you cared enough about them to be educated. I
Yeah.
have heard that over and over and over again from women, just that you care enough. You don't have to have the fix, you don't have to have the answer, but that you cared enough to learn.
Yeah, absolutely. And I think that there's also it takes away any sort of fear. I know a fear is a weird word for this, but I think that there's a lot of guys out there that if they've never learned it when they were growing up, it's intimidating, and then there's a fear around it. Oh, I don't know. I don't want to know how that works. Oh,
Yeah.
that's a woman's that I don't want to know how that works. Or I'm embarrassed buying tampons for my wife, or my girlfriend, or whatever. And I think that that is so silly. Hudson, my husband, is not that. I'll be like, super, or what was it again?
Yeah.
And I think that is great too. That's something to encourage. But yeah, I think that there's a lot of misplaced fear out there, and that's generally speaking, probably how they grew up and what they were around.
Yeah, I mean, the thing is, like, nobody really teaches you how to have sex, right?
Yeah.
And people are left kind of figuring it out. Some people are very curious, and they talk to people, and they have maybe a great partner, and they learn things. And other
Yeah.
people, first experience, may have had a terrible partner and they didn't really know anything. And so, and from a man in a heterosexual relationship, there's a good book out there called She Comes First, which is also
Ah,
a good
gosh.
motto.
Yep.
And so, that's a book to buy for your partner. And I think that's where books can also really be helpful, because if they're
Yeah.
written by an expert, the expert knows the language, and you can be like, "Hey, let's read this book together. Wouldn't that be, like, sexy or fun, to learn more about it together?" And because I would say, sex is a form of communication, right? You're communicating about your body, your desires, what you like. And so thinking about it from a communication standpoint, is a thing
Yeah.
so that's just a good book maybe to suggest for a male partner if anybody needs that.
Anybody out there is, yeah. Absolutely. I always tell, my girlfriends too, I'm like, "Never lie. Do not say that, you got there if you didn't, because it doesn't help anybody. It's understanding yourself and having your partner understand you is such a basic thing. And I think that women tend to also just feel like they're a hassle, or I don't want to make my partner feel bad, which is so backwards.
Yeah, I mean, I would like to think that partners would wanna know and they wanna communicate, and it's hard because if you, again, grew up in a society where you don't talk about it or there's shame, like, how do you have that conversation? But I always tell people, if you can talk about what you want for dinner, you can probably talk about what you want for sex, but sometimes it's useful just to have some education and some knowledge and how to talk about it. And so, so there definitely are, some like good books out there. Another book that I recommend for people who might have libido related concerns is Better Sex Through Mindfulness, by Dr. Lori Brotto. And because, the brain is a very powerful sex organ. Uh,
Yes.
so a couple of reading material there for people.
Yeah. Actually, since we're talking about sex, um, what do you think that women should do when they have a low sex drive? Because that could be a sign of not being healthy either. Um,
Yeah.
you know
So
that.
So when we see people in that situation, we want to get a full history. We want to know, what's going on medically, but we also want to know what's going on at home, right? Because sometimes it's because they're not being treated very well. Sometimes it's because, they're haven't been sleeping. Maybe it's also because of a medical condition. So we take like a full history and I kind of have to go from there. And, some of the things to think about, many medical conditions can affect that. If people aren't sleeping well, that can affect that. And so, people need to have a full workup and, a discussion about medications can also have a side effect. Some of the antidepressants can do that. There may be better choices for people. Um, Oral contraception has kind of a mixed bag effect there. The studies are all over the place. There are studies that say that a percentage of women might have low libido, but also others have increased libido, right? So if you've had terrible pain from your endometriosis and now that pain has gone, you might be like, woo, I can have sex now without pain. So, so
Yeah.
it's very individual. And I think a lot of that is like, we just don't know a lot about what's going on. There are carrier proteins for hormones and how those all get affected is just we just don't really know. So I think that it's also important to ask about pain with sex, and that's something that often doesn't come up. So
Yeah.
people, the number of women I've seen over my career who think pain with sex is normal, or also, do you have any pain with sex? And they say just the normal amount.
Oh,
There isn't a normal amount of pain with sex. There should be no pain, and it's either because there wasn't any foreplay, and many women need much longer foreplay than others, right? So, um, and it also can be because people have pain conditions. And somebody mentioned vaginismus, which is a absolute very common cause of pain with sex, which is where the muscles around the vagina are tight. In response to penetration, and then it's very painful. There are nerve pain conditions that can cause pain with sex. Endometriosis can cause pain with sex. Menopause can cause pain with sex. Primary ovarian insufficiency, which is a sort of a form of early menopause, can cause pain with sex. Yeast infections can cause pain with sex. Other chronic infections can. So we need to do kind of a full workup. So it's very important if you have pain with sex, that's going to affect your sex drive, right? If it hurts, want to do it. Um, when people's partners have erectile dysfunction, that can affect libido. I was just at a conference and we had a sexual health seminar and somebody described it as trying to cram a soft marshmallow into a small opening, and that's painful for some women, right? To actually to do that kind of manipulation, and that also can affect libido. And so
yeah.
it's just really important to know like what's going on. And so how we would treat like an individual would depend on, do you have pain with sex? You want to get that treated? Is there a relationship if you want to talk about that? Are you on a medication that might affect sex drive? Can we change that or can we add something in? And so just like any medical condition is going to be a whole thing, but also education is important, which is also
Yeah.
again why I recommend that book, Better Sex Through Mindfulness, because for people who don't have any medical cause. So like everything has been, kind of ruled out. Cognitive behavioral therapy and medical mindfulness are actually the most effective therapies for low libido. There are medications as well, but these approaches are actually more effective. And so we recommend people try to start with those. And somebody also left a good comment. It is crazy that everybody knows what erectile dysfunction is and nobody has heard of vaginismus. I mean, that happens all the time. I mean,
I haven't heard of it. That was the first time I've heard a name for it.
yeah. So, yeah, vaginismus. And for some people, the muscles are tight all the time, and other people, it's just in response to sex. It's one of those things that can just develop. So I see 17-year-olds with it. I see 50-year-olds with it, everything in between. It can sometimes happen, after something painful, but it can just come out of the blue. Some people may have had a history of sexual assault, but lots of people don't. I mean, the sad truth is sexual assault is so common in our society that you know, it's, so many people have it regardless of kind of what's going on from a sex standpoint. There are a small percentage of people with it may have been brought up in religious households where, sex was thought of as something awful. But again, that's really the minority. This isn't an all in your head thing. This is an actual medical condition. And we have treatment for it. Pelvic floor physical therapy, highly, highly, highly effective for people who aren't making the headway that they need to make. We can also do Botox injections in the muscles. So we have treatments. Yeah. And then it's important also to treat any underlying causes of pain with sex. So, for example, someone might come in and they had a run of chronic yeast infections, and that's produced pain with sex, and they're still having the yeast infections. And when you have chronic yeast, it can feel like sandpaper with the friction. And so we have to get that treated before we can even treat the muscle spasm, right? So we have to treat if there's a pain generator. So I have a lot on that in my book, The Vagina Bible. And if you have pain with sex and you get dismissed, then you want to see another provider. And I have no excuses for how that happens. I don't want to make any excuses for anybody in the profession who dismisses people, but it's super, super important to recognize that that's a problem. And there are treatments. People can have skin conditions that can produce pain with sex, lichen sclerosis, so there are a variety of things. So people deserve to be treated. And absolutely, it's true. We hear about erectile dysfunction ads all the time, those god awful ads on the TV with, throwing the football through the
It's
tire.
so bad.
Oh, gee, what's that?
Yeah.
But we don't talk enough about this. So thank you for the person bringing it up. And
Yes, absolutely. I think this is actually there's a lot of talk about birth control being banned, at least in some states. And not only does it break my heart for the actual purpose of what most people use birth control for, but there's also so many people who use birth control for so many different reasons. And I've never personally had to use it for PCOS, but so many of my friends have, or just in general for a plethora of other reasons. Um, how do you feel about that? Do you think that they're going? Uh, how do you feel about that? We'll start there.
well, I'm terrified. So I think that
Yeah.
it's really important for people to understand that a massive amount of the economic gains women have had since the 1960s is directly related to the oral contraceptive pill. And fascism, I'm going to get really political here. Fascism depends on controlling women and expanding populations and all this crazy natalism and all this other stuff. And so having access to reliable contraception is something that is not what fascist regimes want. And, Project 2025 has been about doing all kinds of things, and labeling birth control as abortifacients is a big part of that. And we see all this push on social media from different influencers about how birth control is dangerous and it's going to hurt you. And remember, a lot of that has funding related to the right wing. Okay. If birth control is not, if you want to say birth control is dangerous, then hey, I'd like to talk to you about pregnancy because that should have a fucking black box warning, right? Like, let's talk about that. Nobody is ever talking about, what is far riskier for women. Now, people deserve safe medications, but the oral birth control pill, especially the one with estrogen, can be incredibly useful for people with PCOS who have high androgens. And
Yep.
bringing down those levels of androgens is really something that we can only see or is happens very easily, or maybe easily is not the right word, but with the combination of the suppression of ovulation and giving estrogen back. And that can be revolutionary for a lot of women, people suffering with acne and hair growth and all these other things. It can make a big difference for them. And obviously there's different phenotypes of PCOS, and not everybody benefits from the pill and not everybody wants to take it. But again, choices, the more choices we have, the better. And It's an incredibly cost-effective approach for people. So taking that away is a major issue. We use it to control heavy periods. We use it to treat endometriosis. We use it in the perimenopause to help women who maybe have symptoms. And so it is the estrogen-containing birth control pill is a massive multitasker for many things. I see people who have cyclic itching with their vulva. And so if we can take away the cyclic change in hormones, we can take that away. I see people who get cyclic bacterial vaginosis. If we can take that away, we can actually make a difference, and the estrogen can also be helpful. So there's so many medical conditions where it's an option. And I would say that if you're seeing something on online where it says that, oh, the birth control pill is going to change how you think about men. Really? Do you think that everything? So first of all, you're making an excuse for a shitty man, right? Like, so, right. But secondly, so you're saying women are so hormonal that just taking one little medication can control them? Like, what is that about? So just be incredibly careful about that messaging. And I always tell people, if you see somebody speaking negatively about contraception, you should block that person. They have another agenda or they're uninformed. And only people spreading evidence are the people who deserve your eyeballs.
I completely agree. Yeah.
Right.
This is a random addition. But I also saw the other day that it was only a couple years ago that they started actually using human blood to test tampons and their
Yeah, I
absorption.
think I think that's true. I'm not sure how much it matters though.
I completely agree there that I'm sure they can mimic it and not actually have to use human blood. But I think it was an interesting example of the delay, I guess,
Yeah.
and what works and what doesn't.
They could use sheep's blood. I mean, like, blood is blood, right?
It was definitely clickbait. It
right?
was definitely clickbait. But I
Uh,
was like, oh, that's wild.
yeah, it is. And I think that, those are the kind of things that unfortunately, um, it's true. So you also say, like, is it true? And then does it matter? And I think it's like, everybody, the way, for example, tampons sit in your body is different for everybody else. And there's people who like have heavy periods who do great with like a medium tampon. And there's people who like, they don't think their periods very heavy and, or they might need a super plus, right? So I think that it's good to know like sort of the absorbency range. And I think it is true. Those things should have been tested with blood. But, and, I think that,
Not something to get angry about, though.
yeah, I mean, I think there's like that's not like things that are going to make me angry because a lot of things make me angry. I have to like partition off the things that are like, yeah, like that makes me angry. But am I gonna waste my rage on that? Probably not.
Yeah, exactly. I think that's actually a good point, too. I think there's a lot of distractions out there on purpose, and that's really frustrating.
So I think that the clickbait news has been the worst thing for women because the thing that gets clicks is scaring women.
Yeah.
Scaring women, especially about their breasts and about their reproductive health. And those are the things that get clicks. I always say when we talk about, for example, menopause hormone therapy, it's a very low risk of having complications. The risk is very low. It's there, but very low. Uh, Probably nobody has heard that medications for erectile dysfunction have a low risk of blindness associated with them.
I did not know that.
Right. Low risk, very low risk, but it's there. But you don't read news stories about it. It doesn't make headlines about the folds because scaring men about getting erections doesn't work. It just
Yeah.
doesn't work. So I think that, we have to be super mindful. And I always tell people, you see these headlines and you want to click and try to go to sources that you think are going to be more reliable before you feed the machine. Because at the end of the day, the people in the United States who are running most of the media are male billionaires. So, what is their investment in the truth? And we've seen a lot of shifting. And if we're seeing all this shifting with, right wing funding of people talking about, amping up fears about birth control and other types of things, the news media certainly seems to have that kind of propensity too. So you just have to be very aware. I mean, in the same way, I mean, and this is in all fields, right? Like if a woman, if it's related to, if a woman has a disagreement about something, it's news everywhere. If a man has a disagreement, like nobody even covers it. Like who
Yeah.
cares? Right. Like, women are difficult to work with. I'm sure that's, in your industry. I'm sure that, if a woman says something to a director or whatever, then all of a sudden there's stories about how like she's so difficult. And if a man it does the same thing, there's no stories because nobody
He's
wants
so
to read it.
passionate about his role, obviously, Dr.
Oh,
Jen.
he's passionate. He brings so many ideas to the table. Oh, he's so thoughtful.
Cares about it so much.
Yeah, it hasn't even like nobody writes those stories. So then what we all see is this bias that we're all steeped in.
Yeah. I think one of the harmful things that stems from that is that women start to also kind of get down on other women, and it also fuels that as well. I've seen, I was thinking the other day, I was talking with a friend of mine, and I never had a lot of really close female friends. I've had my one best friend since I was around 9, and she's incredible. And I do have other close girlfriends that I've known for a long time, but not in the same way that I've had guy friends. I always had a lot of guy friends, and I felt like I couldn't really relate to other women, and that changed as I got older, but not as quickly as I would have expected. It's only now as a mom, and to be fair, I think opening myself up as well in other ways, that I've been able to form really strong female connections. And I think a huge part of that is just the way that we actually treat each other and the space we give each other. And I think we are guilty of judging each other similarly, and I hope that that changes, because even just women's health issues in general, if you have a disagreement based on politics or religion or your own experiences, the answer is not taking somebody else's rights away. It's okay to disagree. And I think there's such an importance there where it's not, don't limit somebody else's choice because you won't do it yourself. And it's not just women's health, it's sort of with everything. And I really hope that for women, that we will start truly, truly unifying so that we stand together. I think that's the thing, is pitting ourselves up against each other. That doesn't help anybody except for the wrong sides.
Yeah, so a lot going on. I think people just need to be very aware, and I think that the powers that be are more invested in having people you know have other disagreements that distract from the larger problems. I mean, this I think I heard that in South Carolina they're going to present a law. I mean, I don't know if it's going to get passed. I have no idea how far it is in the chamber or whatever, but the death penalty for women who have an abortion.
Yeah, I've seen that.
Yeah. So boy, you're so pro-life, you're killing women. Okay. Make that make sense. So and I have a theory that, and I'm sure I'm not the only one, that they, you know, push these awful, terrible things and then they back off a little bit. You've got this one awful thing you want to pass and then the super
Yeah.
terrible thing. And if the super terrible thing goes away, then people don't really pay attention to the other thing.
Yep.
So what are the kind of things you're going to be covering on your Substack?
A lot of this, women's health is a huge priority for me. Motherhood, my experience with Hollywood for sure. A lot about PCOS. PCOS is a huge one for me. And just in general, the day-to-day journey with it. I'm definitely not a doctor. Definitely don't want to give an instruction that would leave anybody, following the wrong things. I think for me, it's all about storytelling and expressing my own journey with it. I have a company called Hippie Water. That's a cannabis infused social beverage that started from my own health journeys, and my own frustrations in my health and what I had access to. And so it's a lot of about what in general that category has done for me as a consumer, but also then women in business and how that journey has changed for me. I'm very much still acting and producing and all of the things. However, you know, going into the corporate side is very new for me, and handling those rooms, that's very different for me. And experiencing that as a female, I think it's important to talk about because I think it can be very isolating. Um, and so it's a mixture of a lot of different things. I know I threw a lot out there, but I think ultimately it's important. Women are a lot of different things. And I think, if you can't relate to one thing, you can relate to something else. And it's about showing the full picture instead of just, a little itty bit. And so that's more so what I'm hoping for, is that by sharing my experiences and amplifying other people's voices, that you'll start to make a difference. I have a podcast called Women in the Nude, which I would love for you to come on, if you're up for it. I think our listeners and our viewers would be ecstatic to hear from you and learn from you. But yeah, I mean, I think ultimately education is my main priority, or at least getting people curious to look into their own health, mental health as well. But and just what it is to be a woman ultimately.
Oh, that all sounds amazing. Well, I'm looking forward to seeing more. And yeah, I'd be happy to come on your podcast and see
Awesome.
the conversation further. And can I just put one little plug in for my book?
I was going to do it, so you're going to be better at it. Please do it.
So this is my book Blood, which is now available in paperback. So it's even
Yeah,
less expensive. And this has everything, all the stuff that you hear online about birth control, or, it's all answered in here. I have a chapter on PCOS, a chapter on endometriosis, a chapter on pelvic, there's on pain with your periods. You learn about your hormones, how it all works. I don't think I've ever had a direct message from somebody that isn't answered in this book. So just putting a plug for that.
that is awesome. And I'll link it and we'll amplify it. That is,
Oh, thank you.
again, I'm going to say it again. I'm so thankful for women like you, doing the good work out there, and dedicating your life to something like this, because it's not an easy road. And I just so appreciate you.
Well, thank you. And it's always great to have voices that want to, elevate advocacy for women and access to good knowledge. And hopefully we can do some more things together down the road.
I agree. And before we head out, what can we find on your page? I don't want it to just be about my
Oh,
side.
well, yeah, the agenda
Yeah.
today. Yeah, so sort of it's like the intersection of feminism and culture and politics and health and the things that you need to know about your body. I cover, there's a lot of menopause content, but there's a lot of content about contraception. If there's ever, new drugs that come out, or there's a viral story about any health condition that touches women, I'm going to be reporting on it and, giving you everything from, hey, this is a cool new study, to what the hell is going on with this drug, what's happening at the FDA, and why you should care.
Yeah, I love it. Well, I'm a follower. I so appreciate you. And until next time,
All
and I'll
right.
link everything below.
You take
Thank you so much. You too. Bye.
All right.